Come on. Ready? Here we go. It's shitty out here. Yeah. What you saying back there? You're not gonna talk? I don't have anything to say, Mom. Sun's not even up yet.
Unfortunately, there was a little bit of confusion at the hospital with the scheduling center and the OR times. We got to the hospital at 5:30 only to find out that Sebastian was not on the schedule. So we ended up going home and they rescheduled his surgery for noon.
Round 2.
Damn, this car's...
You ready to go?
You got the paper this time?
I do have the paper this time.
Wait, what did you do?
What's he doing?
His little smile.
Round 2. Ooh, what you got right there?
Good job.
Wow. Okay, why are you crying?
104, okay.
Honey. Doing good. Just waiting on the doctor. Sebastian is very, very anxious. Very overstimulated. I'm just trying to keep him comfy and relaxed. You're okay. You're okay, honey. Look at the TV. Look. Can you see that? You got your own TV. Look at it. That's pretty cool.
Oh, they took these off? What the heck?
That's the easiest thing to steer.
I got the new setup. You're okay. Nothing bad's happening, okay? Okay. You ready, mister? Just relaxing. You're so handsome. Hi. Hi. Hi, beautiful. You take a nice little nap. It's really hot in here. I was hot too. It was probably anxiety, literally. And the room was just hot.
You let me know.
Yes.
I never ordered that one, so
Should be any time now. It's just him. I'm just relaxing. Look at those long eyelashes.
you're so delicious. Beautiful, wonderful, delicious. Yeah. Oh shit, I'm gonna cry though. Oh
He's signing for food. He's hungry.
shit, I'm gonna cry.
Mm.
Oh shit. What? Is that a cry or laugh, dude?
Mm.
Which one?
I think it's a little
Which
bit of
one?
both.
Are you gonna laugh or are you finna cry? You finna laugh or you finna cry? Which one? Which one? Which one? Which one?
Both.
Which one?
Aww. There's my smile.
Please, please, please. The knees, the knees, the knees, the knees.
His legs look so long.
The knees, do the knees, money, now hurry up on the cry. Hurry, money, now hurry, hurry to my knees, because I'm gonna cry. I'm gonna cry if you don't do my knees.
There he is. What were you saying? Hello? Hello? Just putting him to sleep. Poor baby, he's so tired. I need rest. You say bye-bye to all that wax in your ears. You see how much is in there? I left it in there so they could see how it looks every day. Yeah, your ears. Good job. Yeah.
Ooh, that feels nice.
Your ears. He's touching his ear. You guys stinky
It
ears.
stinks.
Yeah.
Ooh.
He just rolled his eyes in.
Okay.
I remember.
Talked about that a little
Yeah.
bit in clinic. That's called a chronic mastoiditis, and it is a fixable problem. But the fix of that is to do what's called a mastoidectomy. A mastoidectomy means that you go in and you actually remove some of that bone that's back there. So it's a bigger procedure. Okay. So
That could possibly take place today.
No.
When
no,
you're in
no,
there.
no,
That's like
Oh.
last
No.
case.
no, that's not for today.
That's the
No.
last thing we'll explore.
So we would do that only if we're failing with all these other things. But the question always will become, what is the cost to him and what does he stand to gain? All right. So if he has chronic draining ears and that's a big part of his life and he's constantly has his ears draining, at some point, then there's something very real to gain.
Yeah.
You know, even if it means that he has to go through a procedure.
Yeah.
So if he has, you know, minimal drainage and life is okay and it's not a big deal, then the answer is we can leave it alone, right? We don't have to do it. Talk about the fact that he doesn't have a lot of good hearing, right?
Yeah.
That's not a major part of this decision making. This is really about keeping him from being chronically infected,
Yeah.
constantly on antibiotics, constantly uncomfortable, because it is uncomfortable to have that.
Yeah.
So, you know, if he keeps having drainage and it's, you know, once in a blue moon and he's okay, then the answer is we leave him alone. We don't have to put him through that. But if it's that this is a huge part of life and he's, you know, this is either we're treating him or he's draining, then that is something that eventually we think about.
Okay.
Yeah, but no, not for today. Okay. What questions can I answer?
Are you just propping his airway open today, or is he going to be intubated?
I'd rather do it without intubating him.
Okay.
There are essentially 3 ways that we do this. One is with a mask only,
Okay.
okay? And when they do a mask only, that's how we usually do it.
Okay.
Then nothing even goes past his lips, right? It's
Okay.
just sitting out here, they give him some anesthesia and that's that. Sometimes we don't even put an IV in.
Okay.
We just do that. I don't know, the anesthesiologist may feel that he needs an IV. I would sort of leave it up to her. She's one of
Okay.
the cardiac people and she probably has met him.
Okay.
So, with or without an IV, it's possible that he just has a mask. The second way is with an LMA.
Yeah.
LMA is the mask that goes inside the airway. So that's in the mouth, but it doesn't go through the vocal
Doesn't go all
cord,
the
so
way
it's not
down.
going all the way down. And then the third way is with a breathing tube. It is very, very uncommon to intubate a patient for this procedure.
Okay.
Obviously, we're gonna do whatever we need to do to keep
Yeah.
him safe. So if we're in there and he's asleep and he needs to be supported and the mask isn't cutting it and he needs to get a breathing tube, then we're gonna put a breathing tube.
Yeah.
You know, but we would obviously
You know
like to avoid
Sebastian's
that.
airway, like,
I know. You're
So
the one
he-
who literally saved him last time I saw
yeah,
him.
if it
Oh, you
came,
were in there?
if it came to that.
Yeah, if we needed to do that, we'd do it, but this would
think
be
he'll be-
very, very unusual that we
Yeah.
need to go down that road. So it's this, in terms of the deepness of the anesthetic, you know, if we were doing this for a grown-up, we would give them a local anesthetic,
Okay.
and then we would just do it, right? So it's not a big procedure.
Mhm.
We can't do it under a local anesthetic for him because A, it is very uncomfortable and it's hard to anesthetize him.
Yeah.
And secondly, locally, and secondly, he's not, you know, he's not gonna be super cooperative with this, right? So he's
Yeah.
not gonna, if he's a little uncomfortable and he moves a little bit, it makes this impossible.
Yeah. Okay.
All right.
That was my only question.
It's a good
Just
question, and
about-
I'll mention it to Dr. Ellis when she comes in.
Okay.
Cool.
Yeah.
All right, she'll be going back and then we'll get it done. I'm sorry for this very long day. It's
No, it's
incredibly
okay.
frustrating.
The doctors are gonna come back in 20 minutes to get you, okay? And you're gonna do stuff in here, in your ears. Okay? Yeah, it's gonna help your ears, yes. Yes, your ears are gonna feel better. Yes. And then on the way home, as long as you're not too sleepy, we'll get you some chocolate pudding or something, okay?
Sheesh.
How does that sound? You want chocolate pudding in the way home? Yes.
Okay.
Get lots of ice cream and everything.
Love you. Wanna see you in a little bit, okay? You'll be good, okay? It's gonna be quick, and it's not gonna hurt, okay?
See mom and dad in just a couple minutes.
Yeah. No messing around in there, okay? See you later, dude.
Okay, let's get that back here. Then you guys want to follow us for a minute? I'll show you where you
Perfect.
feel
Little nugget. Done. He's a little confused and not very happy right now, but he did really good. He did really good. You want your hand out? Oh, okay.
Beep beep. You know this. Sometimes they just pass by.
Gotta let everybody know we're coming.
Okay, there's somebody coming. Beep beep, Leroy.
Huh? Yeah, Dad.
There's my dad.
What did he do? Huh?
Yeah, before he's so out of it. He was crying nonstop.
Yeah.
Now he's a little more awake.
What did they do? Did they hurt your ears? Yes.
Did he give me some Tylenol, Dad?
Yes. Did they hurt your ears? Yeah.
Yeah.
Yeah. It's okay though. It's all done, okay? You want to eat some chocolate?
Ooh.
Yeah, is that what you want? You want some chocolate, Oreo? Yeah, is that what you want? We'll get
Sweet
you
boy.
some pudding or something. Yeah, your ear.
Yeah.
Yeah, I know. You did a good job.
Yeah.
Yeah, you did a good job.
Hi. He's so much more
Yeah,
alert
We're
than
gonna give you a little food. Is that what you want?
literally 10 minutes ago. He was a different
job.
kid.
Good job. Yeah, it's Dad. Yeah, it's your daddy. Good job. Let me see this other hand.
No IV,
Good
Dad.
job. Yeah, your ear. Yeah. Yeah.
You did good.
Your ears, they clean them.
That was a big
Yeah,
clean
they're
out.
nice and clean. Are you ready to get some food? Yeah? Do I see a little smile? Let me see. Let me see. Do I see a little smile there or something? You want some food? Good job.
Hi, sweet boy. We're gonna go home, okay?
Good job.
Okay. Needs a nap.
Yeah.
Yeah.
We're breaking out of here. Let's go. I'm ready. See you later. Yay. He's like smiling in between still being pissed.
That's like record breaking time.
It's good time. It's good time. I'm so tough. Who's that for?
It's for the baby. Look at the size. It's like.
Oh. Maybe you should try it. Make sure it's okay for him. My Manina's gonna give it to me. Look, he's
Thank
so
you.
sleepy.
You as well.
We'll watch. He's gonna wake right up.
Alright, you can.
Oh, can we get some napkins, please? Thank you. He's gonna kind of freak out a little bit.
Ooh, surprise! That woke him right up.
I'm stealing that. You can start that if you want when I get into this. What? Ooh, this one is kind of big.
I get ice cream after surgery. Thank you.
Well, you can't eat those M&Ms, so I'll give them all to you.
Is it dripping?
Not yet.
Oh shit, my teeth are froze.
That's cold. You deserve that, Sebastian.
I just had surgery. Shut up, everyone. Don't judge.
I can
Oh, that's so delicious. Rico, rico. I wonder if you could feel a brain freeze.
Probably.
Oh, yeah.
He kind of like makes a little gag face when his teeth get too cold.
Yeah?
So, What's the time? I don't want to show the GPS.
3:54.
3:54. That's a 12-hour day right there. That was crazy.
It's hot.
You need some ice cream to cool down?
Yeah, it's only 58 degrees outside. There's a heat wave.
Mm-mm.
Then it's those M&Ms.
Como te tu ice cream también is going to start melting.
I care more about Sebastian. I don't even know why I got that.
Too late. Oh.
Then,
Are you guys Irish twins?
Yeah.
Technically?
yeah.
'Cause you're only like a year apart, right?
Mm.
Yeah, 11 months? I like the cone. I don't like the cream.
I like the McFlurry.
You can let him lick your ice cream cone.
Yeah?
He's
Mhm.
going to get really messy, though.
Let me see.
Or take the spoon and just give him that vanilla cream.
What do you think of this?
I know how to do it.
Saca la lengua. Stick out your tongue. Stick out your tongue. He does!
I know. My dad can have the McFlurry. I can share this
You're
ice cream.
so funny.
I can share this ice cream. What you doing? You say hi? That was nice. Hi. Hi. Your ears. You get your ears done today? Yeah. Hi. Careful. You snoring?
All right, guys, we are back home. Surgery was a success. He is starting to calm down a little bit finally. He's a little bit more relaxed now. It did end up that both of his tubes were still in his ears, so it was successful. They removed both tubes. As Dr. Sherman thought, they both the tubes were infected. So that was the culprit of him taking antibiotics, getting better, and then kind of falling into basically being infected again. So good news is both tubes came out. Now it's a matter of just recovering. The game plan is just to keep him happy and hopefully just heal, right? He's exhausted. That ice cream was hard work. So I think we're going to call it a night. We do have sushi tonight.
He's going to be on antibiotics twice a day for a week. And then we follow up in 6 weeks.
Yeah.
Keep him, we'll do some Tylenol for the next couple of days if he's not feeling good. But I think by tomorrow he'll be back to his self. And it is Friday. As Gio was saying, we were supposed to have Friday sushi night. And I was so looking forward to it. But I don't know if I'm going to make it tonight. I think I'm just going to pass and have Gio bring me some home.
Yeah, I'll probably just bring her like some rice. She's been craving rice, so
I've been wanting fried rice since before vacation.
Yeah, we haven't had sushi in 2 weeks now from our place that we normally go to. So I'm like fiending for it. So I can't miss out.
I just told him, I'm like, go, because you know we always go with our friends. I'm like, just go see your friend, have your sushi, bring me something home, and I'll meet you in bed.
So that's the game plan for tonight. We're just gonna relax. So
Say
what do you think?
Thanks everybody for your prayers.
Yeah.
And your
Good job.
loves.
Yeah, say yay. Good job, Calvin.
Hey, careful.
All right, guys.
We'll see you sometime this weekend.
We will see you guys next time.